being in healthcare, the healthcare industry, working in the hospital, how do you see the Affordable Care Act affecting care in our local hospitals?
That's a good question. A lot of people are talking about what the impact of Obamacare is going to be over the next several years. And there's, I guess, two clarifications I'd make to that. First, we don't know. It changes a lot. We saw the size of that bill when it was stacked on the desks of the people who voted on it. I mean, it's thousands of pages. There are thousands of requirements in there for the Secretary of Health and Human Services, the Internal Revenue Service, several federal agencies to make rules that enact that. So really that's an ongoing process, and the rules are coming out on a daily basis. They're changing frequently, and so sometimes, in some cases, we have just as much as you can find in the text of the bill to know what in the world it's going to be when it actually becomes effective. So that's part of the difficulty for healthcare providers and for, obviously, for citizens too, to figure out what this bill is, the number of things that were left kind of up in the air on it. The second thing I'd say about it is, I think that, they call it healthcare reform, but in most ways this was health insurance reform. The changes that we saw in the bill didn't do very much. There were just a few little lines here and there that actually had direct impact on care. So the biggest changes that Obamacare made was in insurance. They put a huge number of requirements on individuals, on businesses, all in the name of how they're going to process and pay for insurance, health insurance of some kind. That's the individual mandate you heard so much about. That's what the Supreme Court is calling tax. That's the employer mandate and fees that go along with that. So when you ask about how it affects local care delivery, it's hard to say that because most of the changes happen in insurance, and healthcare providers around the country, but especially the small local healthcare providers, are trying to figure out how this new playing field changes and how you can continue to provide healthcare services when you have this enormous amount of regulation and bureaucracy coming out of Washington.
Do you think it will cause a shortage of doctors?
There's kind of a shortage of doctors right now already. I think this is certainly causing people to take a second look at what specialty they go into if they choose to become a physician, maybe choosing other avenues for advanced education if they have that. It certainly doesn't make the idea of becoming a physician today very attractive. I can say, though, that most people make that decision to become a physician, at least the physicians I've known and worked with. Most people make that decision because they want to help people. They want to use their knowledge and their skills and their talents to help people. So, that's on our side, that's a good thing because that means